Regional health authorities have come under fire over the deaths of 3 children who died after visiting country hospitals in the past 6 weeks. The state government has tried to reassure parents the health system is safe, saying the succession of sudden deaths was a coincidence.
Philip and Sarah Hughes say their son Lachlan was vomiting mucus and had trouble feeding when he was taken to Northam Hospital last month. The newborn baby was never seen by a doctor and instead assessed by a nurse. He was sent home only to return the next day with similar symptoms. This time he was seen by a doctor and a nurse and again discharged. 32 hours later, the infant was dead.
The hospital should have checked him over or at least kept him in overnight just to see what was wrong with him. But they didn't. They just pushed me out the door.
They're not really looking at us like we're human, but it's like, oh, you know, just another person, you know, just right, another number.
It's believed the baby died from whooping cough. The boy's father says the hospital failed in its duty of care and is demanding answers. The baby's case came to light after the death last week of 16-year-old Andrew Allen, also at Northam Hospital. The teenager died just hours after being discharged with a reported temperature over 40 degrees and without having been seen by a doctor. It's now been revealed the WA Country Health Service is investigating a third death, that of a 6-year-old at Geraldton Hospital on Friday morning. The boy was being treated for suspected scarlet fever.
What happened to him is a tragedy, but you certainly couldn't blame the hospital or the system for what occurred. Each incident that occurred, totally separate, totally different.
Whilst we don't know many of the details yet, I think it is fair to say that many of our rural towns are currently seriously under-resourced in terms of their medical workforce.
The coroner is investigating all 3 cases. Veronica Buck, ABC News.